I think from a really young age, I started being a volunteer for National Kidney Foundation and working at tables and things at health fairs. It was just so innate to me. I also come from a family of people who've worked in healthcare, so in community healthcare, I grew up in rural Wisconsin. So I've been around a lot of people who have had really horrible medical issues or didn't needed healthcare access. So I've seen that too, and how people can be impacted when they don't have the privilege of good healthcare, or they live in a place where they can't access it, or they don't have family support and things. So it was always my mission. Ran in my family with nurses and things. Um, so I always knew I was going to work in this space. While I'm a lawyer, I always tell my clients, who are mostly physicians and different healthcare providers, that they're really my people. I'm much more comfortable with them than I am with a room of lawyers, because I identify most with like how to save lives, how to help patients, and how to advance research. So through my career, I've pretty much committed my whole career to doing that kind of work. I have a master's in bioethics, and I've also, was legal counsel for the AMA. I won't go through my whole laundry list, but I've done a lot of things to advance medicine from an advocacy, research, entrepreneurial perspective. And I can't remember not doing something professionally where I didn't feel like what I was doing would have an impact on improving patient outcomes.
So it's my job now to challenge you a little bit. I
Yeah.
have to imagine that despite the fact that this hit so close to home, there had to be many points along the road where you faced different frustrations, whether it was with the system or whether it was with the patient response, or um, it's also a dark area, right? Like there's the emotional impact of being surrounded by these types of narratives, where a lot of times you have to ask yourself, like, is this really worth it, and should I take a step back? Talk to me a little bit about those instances.
Yeah. Personally and professionally, there's a few. I will say the last time I dealt with my kidney disease, this was, I'd say again, 2 years ago when the kidney was just going.